Hello and welcome to Prevention Ed, what adults need to know about fentanyl and xylazine. My name is Katie Greeley. I am the founder of Prevention Ed. I am also a licensed clinical social worker and an individual in long-term healthy recovery. Before we jump into the topic, just want to tell you a little bit about what Prevention Ed does. We are a global substance use prevention organization. So we have a team of prevention specialists who go into the classroom. We typically work with middle school and high schoolers who use our stories as a didactic tool to deliver content about alcohol and other drug prevention. So anyways, let's talk about today's topic and get it moving. Fentanyl and xylazine. So like I mentioned earlier, the majority of our work is with middle schoolers and high schoolers. But we also work with educators, administrators, communities, and we do a lot of parent work. And the reason why I wanted to make this video today is that fentanyl and xylazine have consistently been coming up in the news, specifically in the United States. And it is of top of mind for a lot of individuals. And what I would say, has been a popular topic this past school year. Oftentimes, a question that I get from parents is, how do I keep my kids safe? Are substances laced with fentanyl? I get similar questions from students in the classroom. So we're going to talk about fentanyl, what it is, what risk it presents to young people. We're also going to discuss xylazine, otherwise known as tranq, what's coming up in the news and what is relevant to young people and what our prevention message needs to be as adults that care for the health and wellness of the students and kids that we love and support. All right, so let's start with why we're having this conversation, right? So over the past 2 decades, America, specifically the United States, has seen what we all have heard as the opioid epidemic. Typically, right, the opioid epidemic is, impacting individuals above the age of 25. But nonetheless, right, it's impacted a lot of different individuals from a lot of different demographics and backgrounds. What I think is specifically jarring about this graph right here from the National Institute of Drug Abuse is the total increase from 1999 up to 2021. I believe it is my understanding that for the first time in 2021, we saw above 100,000 deaths of overdose deaths. And then we also saw that for 2022. And I wouldn't be surprised, given all the recent news about xylazine and how it increases the fatality of the likelihood of fatality with opioid overdose, that we'll see that in 2023, it's also above 100,000. But what I want to point out right here is between 2019 and 2021, from 70,000 to 106,000, is a 38% increase in overdose deaths, right? And so what is that? Why is that? It's because synthetic opioids appear to be the main driver in that increase. Synthetic opioids mainly being fentanyl. Okay, so there's some context, some background, right? So we've heard about the opioid epidemic, and recently there's been a lot of news on xylazine, otherwise known as tranq, right? So New York Times reporting on tranq, headlines identifying what tranq is, which is a horse sedative, how the White House plans to tackle the rise in deaths from xylazine and fentanyl-laced opioids, specifically heroin. This was just yesterday, July 11th, 2023. So it's of top of mind, right? And I think it's reasonable for people to be concerned. But I also want to highlight in this conversation some of the data that backs that, we should continue to have prevention conversations with youth, continue to promote primary prevention, and also discuss some other risks given, the increased fatalities due to xylazine and fentanyl that might be present to some of the young people in our lives. Okay, so let's start with what fentanyl is. And let's see if I can move my bubble over here so you can, there we go. So fentanyl is a synthetic opioid that is about 50 times stronger than heroin and 100 times stronger than opioid. It's primarily used for pain relief. Think, cancer-related pain. think managing like major surgeries. Anesthesiologists will use it to put people under, in you know in addition to all the other substances that they use to put people under. And it's typically provided under the supervision of a healthcare provider. So it has medical uses, very, very strong. And, the past 2 or 3 years, we've heard a lot about it being in heroin. And dealers specifically do that to increase the strength of their product so they can get more bang for their buck when they sell it on the street. Okay, xylazine. Xylazine is something that we've been hearing a lot about in the past 6 months and has been connected to a lot of recent overdose fatalities. Xylazine is a veterinary medicine. It's a sedative, like I said earlier, typically used for horses. The nickname for xylazine is Trank. And like I said, it has been found in a lot of batches linked to a lot of fatal opioid overdoses. Xylazine is, something that is resistant to Narcan, which is an opioid overdose antidote. And so, there's a lot of anxiety here for what this means for individuals who use opioids or individuals who might not use opioids but may get a product or a substance that is laced with either one of these chemicals. So I know I'm moving all over the place, excuse me. All right, so what's the big picture, right? So the good news, Prevention Ed, we are data backed. When we talk about substances and substance use trends, we're pulling from the gold standard. And the gold standard that measures alcohol and other drug use among 8th, 10th, and 12th graders and college-age individuals actually is the University of Michigan's Monitoring the Future survey. So for the past 46 years, we have seen a decline in illicit adolescent substance use. So that's the good news. Heroin use specifically, the numbers are incredibly low, right? So the likelihood that an adolescent is going to be exposed to fentanyl through the use of heroin, when we take a look at those numbers, right? This is for Monitoring the Future. This is annual use, 8th, 10th, and 12th grade. When we look at 2022, right? So let's look at specifically 12th graders. 0.3%, right, of 12th graders have used heroin, right? So that is not where we're concerned, where young people are going to be exposed to fentanyl, okay? Separately, right, putting fentanyl and xylazine aside, opioids themselves, as we know, are incredibly addictive and dangerous, right? And should only be used as prescribed by a doctor. So even though, like I said, that 0.3% of young people have used heroin, about 3% of 12th graders have used prescription medication non-medically and annually, right? And so I also wanted to highlight this as adults that care about young people in your lives. Where do they get it from? Typically, if you look at this beige bar right here in the graph, the red, 12 to 17 for adolescents, 43.1% report getting them from a relative or a friend for free. All right, so I just wanted to give this information out there as it relates to opioids, because again, opioids are high-risk substances by themselves without the concern of being laced with fentanyl or xylazine. We'll talk about this later and what you can do, but make sure you dispose of your opioids after they're used. Okay, so every year, Halloween, I'm typically working in a school before the week of Halloween. I always hear about this. Rainbow fentanyl. Fentanyl Halloween candy. This concern that young people are going to go trick-or-treating and there's going to be a fentanyl in the substances, right? This is highly, highly unlikely. Similarly, right, I've had a lot of conversations with parents where they're concerned about cannabis, marijuana, being laced with fentanyl. Again, very highly unlikely. I'm talking about 0.001%, right, of that being a concern for young people. Where I do want to make sure we touch on is the actual real risk, right, I mentioned earlier that about 3% of 12th graders have used prescription medications non-medically in the past year. The place that we're concerned that young people would be introduced to fentanyl is counterfeit pills. Okay, so I'm going to move my cursor again, or my video again, so y'all can read this. So when we look at the trend in adolescent drug overdose deaths, right? Even though, like I said earlier, illicit substance use has gone down over the past 46 years, we have seen a slight rise in overdose deaths, people ages 14 to 18. Why is that? Research published as recently as last year in April reports that it's largely attributed to illicit fentanyl in counterfeit pills. Now, where do young people get these pills? Online, right? Snapchat, through a dealer, right? And I'm going to move my face again real quick, right? They look exactly like the real thing, right? So an example of something that has become more popular among young people, again, a very small minority of young people, but still we have seen a slight uptick in trend and interest, is the anti-anxiety medication, otherwise known as the class of benzodiazepines, Xanax, right? So as you can see, right, when you look at an actual Xanax compared to a fake Xanax, they're very similar. So Xanax is the third most commonly misused illicit prescription among adolescents, and the DEA has reported an increase in seizures of counterfeit Xanax pills containing fentanyl, right? So that is where, right, it's 0.3 of a percentage of individuals will be using actual heroin by the time they're in high school, but 3% of 12th graders will be using prescription medications. Again, a small minority, but this is where we are concerned, right? That they could be introduced to a potentially fatal dose of fentanyl. All right, so should I be concerned? I think there's a lot of things in our news today that are very concerning. But this is something that you can talk to the young people in your lives about, right? So a reminder that substance use of opioids has remained at an all-time low by high school age and middle school age individuals. I think I'm not a fan of the gateway drug rhetoric. Addiction doesn't simply go from 0 to 100. By the time someone typically gets to abusing prescription medication or opioids, right, there have been signs of other substance use leading up to that, right? We do teach in the classroom that addiction is a progressive disease, right? Usually people don't start off with opioids or counterfeit prescription pills. So again, primary prevention, focus on primary prevention, talk about cannabis, talk about alcohol, talk about nicotine, and promote the delay of use of those substances. We know promoting the delayed use of alcohol and other drugs is the number one protective factor for young people. Talk to the young people in your life about the risk of buying prescription medications online and the risk of them containing fentanyl. I get a lot of questions from young people, specifically this past year, about fentanyl, and they want to know how it relates to them. This is the connection. This is how it relates to them. So very important to talk about that with students and your children. Again, promote the delayed use of alcohol or other drugs. If your child is prescribed an opioid, have a pain plan, with your doctor. Be prepared to hold on to that medication, and then be prepared to dispose of that medication appropriately, right? There's products called like doTERRA, which allow a pouch, which allows you to deactivate the medication and throw it out. You can take it to your local police department. You could look up drug drop-off boxes at maybe local Walgreens or CVS. There are options available for you. Look them up online, and please dispose of those medications appropriately. I want to thank you all, if you've made it to the end of this video, for watching. If you have any questions, or you would like these slides, or you would like this data, please reach out to me. My email is katie@preventioned.org. If you're a school or a parent that is interested in having these conversations with your community, with your students, in the classroom, feel free to reach out to discuss the options to bring prevention ed programming into your community, into your school. We would love to hear from you. And we are still booking schools for the 2023-2024 school year. I hope you all have a happy and healthy summer and hope to see you in the classroom soon.